All right, let's talk about something millions of people go through, the pre-surgery medical checkup. It's that final green light you need before most planned surgeries. So, what's it really all about? Let's dive in.
So maybe you've got a surgery on the calendar. Could be a knee replacement, could be something else entirely. What's the very first thing your medical team does to get you ready? Well, it all kicks off with a visit to your doctor for what's called preoperative clearance.
And look, the whole point of this visit is incredibly important, but the goal itself is actually super simple. It's all about making sure your upcoming procedure is as safe as it can possibly be. It's really just a crucial safety check for your own health.
Now, this isn't just a random chat. Doctors are following a very clear roadmap. It's a structured process that starts with your history and your meds and ends with a final call on risk. And today, we're going to walk you through that exact same path. Here's our game plan. We're going to start with the medication checkup. Then we'll get into what I call the 3 pillars of risk. After that, we'll look at a simple functional fitness test. And finally, we'll see how doctors put it all together to make that final decision. Okay, let's start with something super practical, your medications. Figuring out what you should keep taking and what you need to pause on surgery day is one of the first big questions that needs an answer.
And that really is the million-dollar question, right? To take or not to take. It might sound easy, but it's a delicate balancing act. You got the benefits of your daily meds on one side and the potential risks they could cause during surgery on the other.
So here's the look at some common guidelines. Now, what's really interesting is that a lot of this is based on what you might call conventional wisdom, not always hardcore clinical trials. For example, diuretics are usually paused to keep your blood pressure from dipping too low during the procedure. But on the flip side, statins for cholesterol, those are almost always continued because there's great evidence they actually lower your risk. The bottom line, and this is crucial, you have to talk through this list, medication by medication, with your own doctor. All right, moving on from meds. When doctors assess your overall risk, they're basically looking at it through 3 main lenses, or what we'll call the 3 pillars: the patient, the procedure, and your performance. Let's break those down.
So pillar number 1 is all about you, the patient. Doctors use a tool called the Revised Cardiac Risk Index, and these 5 conditions right here are major flags. Having even one of these raises your baseline risk, and the more you have, the more carefully your team is going to plan everything. Pillar number 2 is the surgery itself. And let's be real, not all surgeries are created equal, right? They generally fall into 2 buckets. You've got low-risk procedures like cataract surgery, which have less than a 1% chance of a major cardiac event. And then you have the intermediate and high-risk surgeries. Think major orthopedic or vascular operations, which naturally carry more risk that has to be accounted for. And that brings us to our 3rd pillar, performance. Now, to measure this, doctors use a cool concept called metabolic equivalence, or METs for short. It might sound technical, but it's really just a simple, standard way to measure your fitness by looking at how much energy your daily activities take.
So this leads us right into the functional fitness test. And don't worry, this isn't about having you run a marathon in the doctor's office. It's all about seeing how well your body handles everyday physical tasks, because that's an amazing predictor of how well you'll handle the stress of surgery. So, is there a magic number? You bet there is. It's 4. 4 METs. This is the key threshold. If you can handle activities that take at least 4 METs of energy without getting symptoms like chest pain or super out of breath, that's a very strong sign that your body is up to the task. So, what does 4 METs actually feel like? Well, just getting yourself dressed and ready is about 1 MET. But that all-important 4 MET level, that's like being able to climb a flight of stairs or doing some healthy housework, like scrubbing floors. If you can do that without any trouble, you've hit the mark. And hey, if you're out there playing a game of singles tennis, you're crushing it at over 10 METs. Okay, so we've talked meds, patient risk, surgery risk, and your fitness level. Now for the grand finale. How do doctors take all of this information and put it all together to make that final go or no-go decision? Before anything else, doctors do a quick scan for major red flags. These are active heart conditions that are just too risky to mess with for an elective surgery. We're talking about things like unstable chest pain, a very recent heart attack, or heart failure that's causing you problems right now. If any of these are happening, surgery is almost always put on hold. Safety first, always. Now, if there are no red flags, the decision process for most people is actually pretty straightforward. It works like this. Step 1. Is the surgery low risk? If the answer is yes, you're good to go. If no, on to step 2.
Can you handle more than 4 METs of activity? If yes, you also get the green light. It's only if the answer to both of those questions is no that we move on to the final step. For the patients who land in step 3, doctors pull out a seriously powerful tool called the NSQIP Surgical Risk Calculator. This thing was developed by looking at data from over 1 million surgeries, and as you can see, it's been proven to be much better than older methods at figuring out a patient's specific risk.
The NSQIP calculator spits out a number, a percentage risk of having a major heart-related problem. And here's the clear line in the sand. If that calculated risk is less than 1%, then the surgery can move forward without needing any more cardiac stress testing. And here it is, the whole shebang, the entire decision-making flowchart. Now, I know it looks complicated, but it's really just a picture of the simple, logical steps we've just been talking about. You can see the red flag checks at the top, the questions about the procedure and your METs in the middle, all leading down to that final decision. It all flows together.
So let's just quickly recap the big takeaways here. First, the whole point of a pre-op is to make your surgery as safe as possible. Second, you should definitely expect your medications to be tweaked. Third, your risk isn't just one thing. It's a mix of your personal health, your fitness and METs, and the surgery you're having. And finally, remember that the final call isn't just a gut feeling. It follows a clear, logical, step-by-step process.
We'll leave you with a question to think about. Knowing all this makes you a more empowered patient. So now that you know how the whole process works, what's one important question you'll make sure to ask your doctor at your pre-op visit? Thanks for joining us.